pharmacist and as the Dean of the University of Charleston School of Pharmacy, it is my pleasure to welcome you to the University of Charleston's School of Pharmacy 13th Annual White Coat Ceremony in honor of the class of 2022. The White Coat Ceremony is a unique and special occasion and one that we don't take lightly. Our White Coat Ceremony is one of the time-honored traditions of importance that has been performed since our first class entered in August of 2006. This occasion is meaningful for our profession of pharmacy specifically, and it has meaning to our beloved institution, the University of Charleston. We have planned a great ceremony for our honored members of the class of 2022 and for their guests, our guests. Let's work together in the pursuit of an enjoyable ceremony. Please take a moment to check the status of your electronic devices. We appreciate you ensuring that they are either turned off or placed in the vibrate position. We plan to follow the program as is printed, and so I invite you at this time to sit back and relax and get ready for wonderful treats in word, in song, and in action. The next person who I'm delighted to present to you reigns as a committed and energetic newcomer to the University of Charleston, but they're not a newcomer to the relevancy and importance of healthcare in general, and specifically the profession of pharmacy. Please receive our University of Charleston President, Dr. Marty Roth.
Good afternoon, everyone. Thank you for being here. Special welcome to family, friends, and other guests, and certainly to the class of 2022. We're delighted that you've entrusted your pharmacy education to the University of Charleston, and I have absolutely no doubt that you are in great hands. And you're going to hear a lot from the faculty and the staff of the School of Pharmacy, and so I'm going to just speak very briefly in a slightly different direction. You have a great opportunity over the next 4 years to be at a really terrific university. And while the faculty and staff here are going to have you working really, really hard, you're going to learn more than you ever thought you could possibly be able to learn about healthcare and about pharmacy and about doing all the things necessary to be a great contributor to your profession and to your community. You also have a great opportunity to take advantage of so many things that the university has to offer. So there's 3 things I want you to keep in mind as you're going through your journey to earn your PharmD degree. First of all, you want to make sure that you are getting embedded and networked into the pharmacy profession. Your faculty, your staff will help you do that, but make sure that you're willing to step above and beyond what you're expected to do in the classroom, what you're expected to do to excel as a pharmacy student, to make sure you're really getting as deep of an understanding as you can about all the great career opportunities within the pharmacy profession. Second, please make sure you take advantage of all the great things that you can do outside of the School of Pharmacy here at the University of Charleston. We're a comprehensive university. You're joining close to 1,000 other students who will be with us throughout the traditional academic year here in Charleston. And in addition to the great work that you'll be doing in the School of Pharmacy, take advantage of participating in intramural sports. Take advantage of the opportunity to sing in the choir, to be involved in the many, many student organizations that are available on campus. It will give you an opportunity to continue to expand your horizons, live our mission of not only preparing yourself for productive work, but also enlightened living, give you an opportunity to kind of learn more about what other people your age with your ambition are pursuing from a career and professional standpoint. And it will also give you an outlet and an opportunity to meet and network with other people outside the School of Pharmacy. Third, please make sure you take advantage of the rich environment that we have here in Charleston, West Virginia, and throughout the state. There's so many great cultural activities to take advantage of here that you want to make sure that you have an opportunity to taste all the great food, listen to all the terrific music, see all of the rich art and culture that are part of the Kanawha Valley and the state. So again, you have a great opportunity to be the best pharmacist that could ever come out of a school of pharmacy. That is what we offer you from an educational standpoint, but I also want to make sure you take advantage of the richness of so much else that the University of Charleston has to offer. I wish you the most success on your journey throughout your education. Know that not only the great faculty and staff in the School of Pharmacy, but so many of us here are here to support you, help you to be successful, and make sure that this is a terrific 4 years of your life as you earn the PharmD degree. Thanks for being here, and I look forward to the rest of the program with you.
Congratulations. We're going to start by singing the alma mater because I've been told that you all heard about the alma mater. So I would ask everyone to stand, please. If you know it, you're welcome to join.
Skies and sea. fantasy world to real world, and on this great day, great tradition, and great opportunity for you, the class of 2022, and your loved ones. Welcome. By the way, I'm Farooq Khan, the Associate Dean for Academic Affairs at the School of Pharmacy here, and I'm very honored to welcome you here. And in fact, on this special day, I'm going to introduce to you our keynote speaker, Dr. Brian Hodges. A little bit about Dr. Hodges. He is currently a critical care pharmacy clinician at the Charleston area medical center, and he is the market clinical director of clinical pharmacy services and the program director of PGY2 critical care residency at Charleston area medical center. Dr. Hodges earned his bachelor's and doctor of pharmacy degree from WVU School of Pharmacy, and he also worked here as a faculty member. And not only that, he has been the recipient of Outstanding Teacher of the Year Award 3 times. Dr. Hodges completed a 2-year specialized residency program at I think South Carolina, University of South Carolina, Medical University of South Carolina, and he also worked there as clinical specialist. He serves for us here, he serves as a preceptor, and I think I should say in a different way. He doesn't serve like just as a preceptor. In fact, he was the preceptor of the year by our just recently graduated student of 2018. So he's not just a preceptor. He is the preceptor. And he has practice experience in numerous critical settings, assessing the therapeutic drug monitoring, evidence-based nutrition support therapies, safe drug utilization in critically ill patients. These are a few of his interests in practice and research. He is very well published in peer-reviewed journals as well as textbooks. So now we know why I am so honored to present him here. In fact, he is truly a role model for you all guys, right? The new pharmacist, the future pharmacist here. So please welcome and join me welcoming him as your today's keynote speaker and your role model, Dr. Hodges.
Let me say first, if anybody ever asks you to do one of these things, make sure that you're not going to follow beatboxing and theme song. That's a pretty tough act to follow. That was really interesting. Well, good afternoon. I want to thank Dean Easton and the faculty for inviting me here this afternoon. And even though you don't know me and had no say in me being here this afternoon, I want to thank the class of 2022 for allowing me to share in this important ceremony with you. You know, it's really early in your life as a class together. So the first thing I want to do is take a second and let's all have a chance to get to know each other even a little better. What I want you to do is for each of you to take a few seconds and think back on your career as a student. And I want you to think about what's been your proudest academic achievement along the way of being admitted to the University of Charleston School of Pharmacy. And then once you've had a second to think about that, you talk to the person next to you. Tell them what you're most proud of on the pathway that you got here. The person left, right. Somebody you haven't talked to yet. Tell them something you've been proud of along this path. Come on, let's share. Let's open up. All right, did everybody So, did you learn anything interesting about your classmates around you that you didn't know 30 seconds ago? You probably did. You probably did. I'll trust that you did. You know, knowing the level of competitiveness that it takes to end up in this class, I'm sure that you learned about some achievements of your classmates, you know, that are really pretty impressive. And I would be willing to venture that, you know, some of the things that we talked about may have had something to do with, you know, earning a grade in a really tough course, acing an exam that you really had to work hard to prepare for, you know, stuff like that. And that's really awesome. And obviously, the fact that you're here is a testament to the fact that you've been able to make a lot of accomplishment, to make a lot of achievement in that regard. So now with that done, I'm going to make myself look ridiculous. What are these?
3D glasses.
Yeah, they're 3D glasses. And they're 3D glasses that go with the TV that I've never figured out how to make work in order to watch things in 3D. But they're 3D glasses. And they're a really goofy looking symbol of how your learning is going to change as you move into the professional curriculum here at the School of Pharmacy. Put these back, I don't want to keep these babies for later. All right, you're beginning to transition from a mostly two-dimensional role in your education. The world of the classroom handout and the Scantron form. You guys ever used the Scantron form? Okay. I was hoping that there were still Scantron forms. You know, some places it's gone so far. I saw some students at a bookstore at a university just this past week, and now we're making them buy their own Scantron forms. How tricky it is. And now you're going to move into the three-dimensional learning of the professional curriculum. The learning of the patient, the preceptor, the hospital, the clinic, the care team in the lab. Now, I don't want you to think that doesn't mean that you're not going to have any more tests. I checked with Dean Easton before the ceremony. She assures me there'll be plenty. So don't worry, plenty of tests to take. But it does mean that as a healthcare professional, your learning and your understanding will progress from recall to application to integration to synthesis, being able to take care of people in your community. Your professional journey is going to be defined by three dimensions I'm going to talk about real briefly this afternoon while you're here at the University of Charleston. And I know that your faculty and your staff and the broader university are dedicated to helping you develop in these three dimensions. To talk about the dimensions of knowledge, of skills, and then lastly of attitudes. So as it relates to knowledge, you in collaboration with your classmates and your faculty, you're going to memorize a lot of facts. You're going to know a lot of things. I recall a lot of long days and long evenings trying to remember a lot of things, and that's one of the things people know me for, being able to remember a lot of stuff. And remembering stuff is really helpful in this job. You've got the goal of soaking things up for that therapy test, or taking it all in for a challenging patient evaluation during an internal medicine APPE experience. And that's going to happen, and you're going to do it. But one thing I'm going to let you in on a little secret. Almost as or more important as learning a lot of stuff, while you're here in that knowledge dimension, I would encourage you to keep paying attention on learning how to learn. I find that to be as or more important as the tidbits of stuff that you can memorize and kick back to somebody. And that's because the consensus ideas and the gold standard treatments that you're going to be taught over the next 4 years are really important, but by the time you get out into practice, they may well change. I can tell you that when I was in pharmacy school, I was taught that if a patient presented with sudden onset, really high blood pressure that was life-threatening, that cutting open a capsule of nifedipine and squirting it under their tongue would be beneficial. Do you know what we know about that now? It's potentially deadly. You know, it hurts more than it helps. Early on in my APPE experience, we never would have recommended that a person who has heart failure be treated with a beta blocker. And now we know that that class of drugs is really part of the bedrock, a foundational treatment approach to helping those people live longer. So learning how to learn, being able to adapt to what comes next, is going to be a great benefit to you that knowledge. Just within the last couple months, there have been 2, maybe 3 pieces of new clinical research that have totally changed the way I approach some really common things that I deal with every day in the intensive care unit. So you're constantly going to be challenged to learn and relearn. So knowing how to learn and learning how to learn is really going to be a key element in your professionalization here. Now, who in the class has seen the movie Napoleon Dynamite? Have we seen that? I've seen that. I think it's pretty fun. And I can't think of the skills domain in the skills dimension in your experience without thinking of Napoleon Dynamite, talking about how attractive, how admirable skills are. Now, you're not likely in the pharmacy curriculum to gain much in terms of bow hunting skills or nunchuck skills or computer hacking skills, except maybe in your drug information class. Ask Dr. Shelley if she covers that. She might. But you are going to observe and develop technical skills that in your future are going to be so important to providing service to your patients in your community. In compounding labs, in IV room simulations, you're going to practice techniques secundum artem, following the practice of, some of which have been part of the apothecary tradition for hundreds or sometimes even thousands of years. In contrast, you're going to be hands-on with some of the most advanced healthcare technology and automation that you're going to use to continue to benefit your patients. In the skills dimension, one of the more important things in the last part of that I'll mention is communication. Developing your communication skills is a vital element of this dimension, and one that you're going to engage in across your curriculum. When you work together as a team on group projects, even the most brilliant of your recommendations can be worthless for a provider, for a patient, a classmate, a preceptor, unless you express it to them in a way that's understandable and persuasive. You'll soon learn that as a pharmacist, you're most effective when you can speak and write in a number of different dialects, even if you're dealing with groups of people who all speak the exact same language. Your terminology and your approach are going to have a major effect on your outcomes. And I'm barely scratching the surface of that skills dimension. So the last dimension I want to talk about in this exhortation to the class of 2022 is about your professional attitudes. Your professional attitudes are going to exert a tremendous impact on your classmates, coworkers, future students, and especially your patients. This school has a strong reputation for encouraging, nay, mandating, that you demonstrate covenantal dedication to professionalism and patient-centeredness. You need this to carry on with you well beyond your years here at the University of Charleston. Your patients expect it and require it. And you, many times, are going to be dealing with them on the worst days of their lives. You know, I think back as a resident to, as you mentioned, in South Carolina, a little 5-year-old boy who he'd had a summer cold. And for whatever bad luck reason, that virus affected his heart muscle. And he was in the pediatric intensive care unit while I was on my rotation there. And I remember talking to his family as he went through dialysis, as he went through heart-lung bypass therapy, as he underwent a heart transplant, as he developed a condition that caused blood clots in the veins all around his body. And we had to figure out how to give him a blood thinner that had barely been approved in the United States, and how to get some drug information on it translated from German. You can imagine what his family was going through. And you can imagine what a family like that needs and requires from you as a member of the healthcare team in terms of your attitude and your empathy as you deal with your patients. Now that's an extreme example, but you're definitely going to deal with similar situations. You're going to be dealing with the daughter who's trying to decide how aggressively her dad's condition needs to be treated. You're going to be dealing with the husband whose insurance just rejected a prescription claim while his wife, just discharged from the hospital, is sitting out in the car. You'll be dealing with the mother whose firstborn has a fever. These people need you and want you to empathize, to care, to identify, and to maintain that professional attitude and that caring. Even though it's your routine day, you've got to remember it may be one of the more landmark events of their lives. And I know that you will. And I know that with the support and the encouragement of the faculty, that you'll continue to develop those skills. I think about a pretty wise guy who I work with, and I'll close with something he tells me all the time. And it's paraphrased from a Maya Angelou quote about what people take away from what you say and what you do and how they remember you. And he's the unit clerk in the hospital where I work, and he's kind of a goofball. But says a few things that make a whole lot of sense. It's something that I'd like to stick with you as you move on from today. He says that patients don't care what you know, they just want to know that you care. And I think that's very true. And there are a lot of things that you're going to learn over the next 4 years. You're going to gain a lot of knowledge, you're going to gain a lot of skill, and hopefully you're going to develop a really great set of attitudes. I wish you luck. I really appreciate the invitation to share this afternoon with you. And my wish for you is that the rest of your professional lives stay in 3D. Thank you.
Thank you, Dr. Hodges. At this time, I would like to invite the class of 2022 to come to the stage and receive their white coats. Adams. Michaela Burron. Sydney Byerly. Carmelita Brown. Ramya Bersenji. Nathan Bush. Emily Chatton. Ahmad Shrain. Kaylee Christian. Allison Coles. Sarah Combs. Kaylee Davis. Aaron Dorch. Everett Eller. Tara Evans. Trey Faber. Joyce Bojaroki.
You look good.
Zachary Harris. Karen Hernandez. Trevor Bolowinski. Raynell Horn. Eric Johnson. Rajveer Kaur. Mackenzie King. Nina Kalani. Moses Kusambor. Duharni Kavadia. Casey LaBelle. Ashley Lamb. Ashley Luster. Ali Mackey. Abigail Mba. Erica McCall. Afaf Ugali. Stanley Ogwatu. Olushola Joy Akayami. Gabrielle Colombo. Brenda Patel. Nadisi Richards. Matthew Richardson. Adrian Esteban Rodriguez. Anna Rooney. Lauren Shelton. Clayton Snow. Rebecca Sparks. Nyla Taha. Mene Olivier Chimo. Kevin Ton. Austin Trent. Zachary Wagaman.
What are you doing, Zach?
Cheryl Wagner. Jennifer Wine.
That's my girl.
Kalima Yansane. Janice Yanni. Joy Zhang.
this time, I'd like to ask the students, the pharmacy students, as well as any pharmacists in the room to please stand as we recite the Pledge of Professionalism. As a student of pharmacy, I believe there's a need to build and reinforce a professional identity founded on integrity, ethical behavior, and honor. This development, a vital process in my education, will help ensure that I am true to the professional relationship I establish between myself and society as I become a member of the pharmacy community. Integrity will be an essential part of my everyday life, and I will pursue all academic and professional endeavors with honesty and commitment to service. To accomplish this goal of professional development, as a student of pharmacy, I will develop a sense of loyalty and duty to the profession of pharmacy by contributing to the well-being of others and by enthusiastically accepting responsibility and accountability for membership in the profession. Foster professional competency through lifelong learning. I will strive for high ideals, teamwork, and unity within the profession in order to provide optimal patient care. Support my colleagues by actively encouraging personal commitment to the oath of pharmacist and the code of ethics for pharmacists as set forth by the profession. Dedicate my life and practice to excellence. This will require an ongoing reassessment of personal and professional values. Maintain the highest ideals and professional attributes to ensure and facilitate the covenantal relationship required of the pharmaceutical caregiver. The profession of pharmacy is one that demands adherence to a set of rigid ethical standards. These high ideals are necessary to ensure the quality of care extended to the patients I serve. As a student of pharmacy, I believe this does not start with graduation. Rather, it begins with my membership in the professional college community. Therefore, I must strive to uphold these standards as I advance towards full membership in the profession of pharmacy. As a class, we voluntarily make this pledge of professionalism. Thank you. You may be seated.
So we've come to the time of the program where we have closing remarks. As part of the closing remarks, I'd like some audience participation. The audience participation I would like is to ask a question, and if you agree, I'd like you to clap 3 times and then wave your hands. Simple enough. I'll ask the question. In response, if you agree, clap your hands 3 times, and then let's wave our hands. Everybody got it? Okay, so was this a wonderful ceremony in honor of the class of 2022 at the University of Charleston School of Pharmacy? Will you continue to support and encourage the members of the class of 22 to embrace the tenets of professionalism, both inside and outside of the classroom? If you agree, clap 3 times and wave your hands. Are you happy to be here? Are you ready for this to end? All right, oh great. So the activities, accomplishments, and achievements of the School of Pharmacy and the University of Charleston are comprised of individual, group, and programmatic efforts. I'd like to take time to acknowledge the hardworking and committed activities of the School of Pharmacy faculty and staff members and ask them to stand and show your support of them. Of the 55 members of the class of 2022, approximately 13 of those students received their pre-pharmacy curriculum instruction by dedicated members of the University of Charleston faculty. They were encouraged and supported by university administration and others. I saw Debbie Bannister, and I know that there's some others here along with our president. I'd ask them to stand and be recognized and for us to show our appreciation to them. I saw one of our alums who's not a member of our faculty. We have about three faculty members who are graduates of our program. I also saw Kurt Meadows, a graduate of the University of Charleston School of Pharmacy. And if there are any other alums from the University of Charleston, would you please stand and be recognized? Second to last, I'd like to recognize future aspiring pharmacists who are either UC pre-pharmacy students or special guests that we've invited to join us in this 13th annual White Coat ceremony. I'd like you to see them so that you can encourage them to continue on their pursuit to becoming pharmacists. And so I've asked these persons to stand and be recognized. Tiffany Chiders, Cassandra Demps, Emma Heisen, and Susan Govender. Congratulations to them. We look forward to the day when they will be sitting where the class of 22 is sitting and receiving their white coats from our program. Lastly, I thank you for your attention and your attendance. It means the most to the class of 2022. It means the second most of importance for us as a School of Pharmacy community, as well as a university community. I invite you all to our reception where we will continue to celebrate the achievements of the members of the class of 2022 as they have their white coats and they look so good in them. What we will do at the conclusion of this ceremony is we will proceed to the steps on Riggleman so that we can take a group photo of the class, and the faculty and staff members of the School of Pharmacy, and we invite you to come and take pictures if you so desire. So thank you again for attending the University of Charleston School of Pharmacy 13th Annual White Coat Ceremony. Congratulations to the class of 22, and that's all.